Hello everybody. This is my online educational video for a complex case about paediatric burns. My name is Alicia Brown and I am a paediatric burns physiotherapist who works at the Sydney Children's Burns Hospital with 5 years experience in full-time paediatric burns care. And 2 years ago, I travelled to Rwanda for some physiotherapy work. Recently, some of my colleagues from Rwanda who work at the University Teaching Hospital of Kigali reached out to me asking if I could develop an educational video about the basics of burns first aid and physiotherapy management of burns for their medicine and physiotherapy students that they have working at their hospital. So let's start with some epidemiological data about burns internationally and in Rwanda specifically. These burn injuries occur worldwide with high numbers of mortality and morbidity rates in paediatric populations of developing countries around the globe. The World Health Organization also states that children under the age of 5 in the World Health Organization's African region have over 2 times the incidence of burn deaths than children under the age of 5 worldwide. A retrospective overview of a 1-year period between June 2014 and June 2015, with data retrieved from case files of the patients at the University's Teaching Hospital of Kigali, showed that 72 children were admitted for burns within that year, with scalds accounting for 93% of cases. 92% of the burns were partial thickness burns, 64% of burns patients were male, and 78% of the children were 3 years and younger. The study also found that a total body surface burned greater than 25% and or full thickness burns were associated with higher mortality rates. The average length of hospital stay was 21 days, and there was a mortality rate of 17%. Which is a higher mortality rate than reported from studies from other developing countries. Now, I will explain the case study that prompted the creation of this presentation and educational video for the student colleagues. 2 weeks ago, a 3-year-old boy, Emmanuel Jean, was admitted to the University Teaching Hospital of Kigali in Rwanda with partial thickness, mid and deep dermal scald burns to approximately 27% of his body, with the burns present on both of his arms and hands, his anterior neck and anterior trunk. These burns occurred after Emmanuel knocked a teapot full of boiling water off a table and it fell onto him. Emmanuel's parents immediately removed his clothing from the affected areas and brought him into the emergency department of the hospital within 20 minutes of the burn occurring. However, at the time, they did not run his burns under any water. Emmanuel is still in the pediatric intensive care unit 2 weeks following his injury, and he has struggled greatly from dehydration and respiratory issues throughout his stay at hospital. However, Emmanuel is now expected to recover from his burns. Now, you might be wondering why I mentioned the fact that Emmanuel's parents did not run the burn areas of his body under running water. Why is this important? This is where we get to the part of my presentation about the basics of burns first aid. Firstly, let's watch the video from the Queensland University's Technologies YouTube channel and the Cool Runnings app. That video showed an extremely similar situation as to what happened to Emmanuel and included a reminder to keep heat away from children and a reminder to run burns underwater for at least 20 minutes from the burn occurring. Running burns under cold water is not the only way to manage burns straight after they occur though. There are more steps that we should take for ideal management. You should. 1, stop, drop to the ground and roll to put out the fire if this is the cause of your burn. 2, Remove all heat sources, including clothes, nappies, and jewelry, unless they are already stuck to the burn. 3, place the burn under cool running tap water for 20 minutes. Do not use ice. And 4, use a clean cling film to cover and protect the burn. Then seek emergency assistance in an emergency, as always. Perhaps the severity of Emmanuel's burns could have been reduced if they were run under cold water at the time of injury. Once a child is in hospital for their burns, medical care will often consist of wound debridement and cleansing and wound dressing. There is antibiotic treatment, pain relief, rehydration and nutrition care, and physiotherapy management. It is also extremely important to prevent contractures of the scarred skin, especially in children who still have a great deal of growing to do. This is where physiotherapy can be extremely beneficial. So, alongside the contracture management, physiotherapists can also assist with edema control, stretching, exercise prescription, splinting and positioning, prescription of compression garments, silicone product application, skincare guidance, scar management, massage, and education. Exercise should start as soon as possible and ensure that the patient has adequate range of motion in affected areas required for ambulation and for their daily activities. This is crucial. And range of motion maintenance may have to be monitored for 12 to 18 months post-burn. Just ensure that you are aware of any precautions and contraindications when starting exercises and stretching. So something to keep in mind is overheating. You may need to modify the environment where possible, such as air-conditioned or cooled rooms, removal of excess garments, and ensuring the patient is adequately hydrated. Improvement in home safety, encouraging people to treat burns as soon as possible, and raising awareness of preventative measures and burns first aid through education and public health campaigns could help to reduce the frequency and severity of burns in Rwanda. Education and public health campaigns alongside appropriate burn care in hospital can also help us to reduce the length of stay in paediatric ICUs and in general hospital stays for children like Emmanuel. Thank you for taking the time to watch this educational video about the prevention and treatment of paediatric burns. The references that I used for this presentation will now be shown on the next slide. Thank you and have a lovely day.